Good afternoon and welcome to the Department of Behavioral Health Weekly Update. We skipped a week last week with our all-staff meeting, so we'll jump right into this week's presentation. To start with, June is Pride Month. And so we have a number of activities. I wanted to highlight a couple of them for you. We have speaker panels on 2 different days. One is on June 8th from 1 to 2:30, and that will be Facebook and YouTube Live with some of our staff and some individuals from the LGBTQ+ Center. And they will be having a talk about mitigating risk factors and affirming and accepting environments for LGBTQ+ youth. And then the second panel will focus on improving care through understanding the intersectionalities of LGBTQ+ persons served. And that will be on June 25th from 12 to 1:30, Facebook Live and YouTube again. And our former Diversity Services Coordinator, Dr. Tiffany White, will moderate that. And we'll have staff from the department as well as a foster youth advocate from CASA and a couple of other individuals. We'll send out those flyers and you can see that. Our own Gavin Harrison is also moderating the first one. So look forward to those events and many more through the month. All right, jumping into COVID. Worldwide, I'm showing you June 3rd of 2020 because it just so happened that I had a presentation on that day. And so I thought it would be good every once in a while, as I've done previously, to just kind of ground and center us with where we were a year ago. A year ago across the United States, we had a little under 6.5 million cases of COVID, and we had experienced 382,000 deaths. And as of today, we have 171,832,000 cases. 3.694 million deaths have occurred. So significant increase as we've all experienced. And in the United States, we had 1.839 million cases and had experienced 106,553 deaths. And we're now up to 33.3 million cases and 596,312 deaths. And so worldwide, the increase in deaths is much greater than what we've experienced in the United States. And likely that is because we've been able to didn't have as many of the shortages that some parts of the world have had in care provisions, supplies like oxygen and such. We've talked previously about places like India where they're running out of those supplies. And so we did a little better, even though we've certainly had a lot of loss. And in California, we're now up to 3,686,689 cases. Interestingly enough, it's about the same number of cases as we had experienced across the nation a year ago, and 62,092 deaths. We've now administered over 66 million COVID tests. Currently, we have a 0.9% positivity rate, and that under 1% is a great news for California. And we've now administered 37,826,298 vaccine doses. In Fresno County, we're up to 102,547 cases, and we've had 1,707 deaths. And to the right, I show you where we were a couple of weeks ago. And so we haven't seen a huge increase, just under 500 additional cases over that 2 to 3 week period and about 17 deaths. So really a testament to how much COVID has slowed down in our community. In terms of hospitalizations, as of yesterday, we had 43 individuals hospitalized with confirmed COVID, and 9 in the ICU with 23 additional ICU beds available. And so if you look to the right, you'll see that both of those numbers have really declined over the past month or so in terms of hospitalization, almost cut in half. And our ICUs still also cut in half over that period of time, and we have a lot more ICU beds available. In terms of our tier system for reopening, we remain in the orange tier. This is an old slide. My apologies. That should have been updated, but we do remain in the orange tier. And in terms of the statewide tier, you can see on the bottom that we're really getting rid of most of the red. We just have a few, I think 4 counties remain in the red. Every other county is either in the orange or the yellow. So again, my lame joke about returning to the golden state. Got to get everybody into the gold. In terms of vaccinations, we're now over 811,000 vaccine doses administered in Fresno County, really something to celebrate. That's a little over 40% of everyone in our county has had at least 1 dose, and over 48% of those eligible by age. So for the population of 12 and over, 48% has had at least 1 dose of the vaccine. So we now have 341,730 people fully vaccinated and 90,346 partially vaccinated. That means they've received 1 dose of a 2-dose regimen. And then 83.1% just keep inching up of individuals over the age of 65 have received at least 1 dose of vaccine. So continue to make good progress on all fronts. So cases continue to trend down in Fresno County while our restrictions ease. That combination really bodes well for the future. Hospitalizations continue to steadily trend downward. We've had a couple of days where it bumped up, but for the most part, trending down. Deaths also trending significantly downward, and we continue to have vaccines available for 12 and over. Nationally, we see those trends going down as well. Today, the president announced that 25 million doses of vaccine would be made available to other parts of the world, including India and other parts of Asia, Latin America, the Caribbean, and Africa, all parts of the world who have a much lower supply of vaccine available based on their population. Some of those countries, I know several in Africa, have run out of vaccine, and so we're really at the stage that the United States and other countries need to support the rest of the world if we're going to get this under control and prevent the development of additional challenging variants. I did want to throw up the India slide to show you that those numbers are starting to go down. But still a lot of prevalence of COVID in India and many challenges to their healthcare system. It's going to literally take years for them to recover from. So the rest of today's presentation, I really wanted to focus on our return to on-site work plan. I discussed it last week a bit, and we had initially hoped to have something published for you sometime this week, but there's been a number of constraining factors for us, not the least of which is that Cal OSHA is producing some guidelines that our board has to vote on, and then the county has to decide how we're going to implement those guidelines. We're waiting for some direction from the public health department, and so we've delayed it until likely next week that we'll publish it. But I did want to give you a high-level view, and I also want to reassure you some of these slides are going to be hard to read, and so when we send out the recording of this presentation today, we will send out this next set of PowerPoint slides for you to be able to view at your leisure on your desktop or laptop, where it might be easier for you to read all of them. All right, so we have a little welcome back slide. And so we have kind of phases that we're going through, and they go from top to bottom, and we have 3 slides, so I'm going to go through them with you. So since we really started the emergency order back in March of 2020, until now, any staff can be called back to work at any time on site, to work on site, and we continue to do that as needed. Starting in April of this year, our leadership and facilities really has been working hard with the County Human Resources Department and Risk Management to develop a very comprehensive return to on-site work plan. And the county HR noticed our labor partners of the June 1st approximate return to on-site work timeline. We've had some adjustments to that for the reasons I just stated, but that's when we began working and noticing them. June 3rd, today, Cal OSHA employer guidance is to be voted on, and then June 7th, we hope to publish the plan. And over the next few weeks, whenever we publish it, there'll be at least a couple of week period where we start to bring some staff back who are in individual offices and really have our management staff working very closely with their teams to determine what staff might have a hybrid work schedule, some work from home, some in on-site work, and which staff are going to come back on-site right away. And for staff who have a hybrid schedule or might be working from home for a little longer, there'll also be some discussion of what the progression of that will be. And then June 15th, as we've stated multiple times, the governor has announced that we'll open up the state of California under the blueprint. So even though I've been reporting on these tiers, the tier system will largely go away come June 14th, we anticipate. And so once we have published our plan and begun getting our management team on site and bringing people back, and we'll continue to work with team members in shared spaces and also with individual accommodation requests in conjunction with our Human Resources Department. And then by July 31st, we expect all staff to have a routine schedule of on-site work, whatever that is, or at their assigned work locations per everything that's going on and everyone who regulates us. So that kind of gives you the phases. I did want to talk to you about what our work plan considerations are, and this is where that font is really small, so if you can't read it, I'm going to read it for you and then we'll send it out to you. We're really looking at guidance from the Center for Disease Controls, the California Department of Public Health, the Fresno County Department of Public Health, our Board of Supervisors, as well as our County Administrative and County Operating Officer, and County HR Risk Management. We also are working with County HR and County Council to review those Cal-OSHA updated guidelines. We're pending some updates from Public Health and the Board of Supervisors, and then awaiting Governor Newsom's opening order. So in terms of preparing our own workspace, working with County Human Resources and Risk Management and county facilities, we've looked at capacity of individual workspaces, individual offices, lobbies, cubicles, conference rooms, break rooms, hallways, restrooms, waiting rooms, I'll throw that in there. Janitorial services based on public health guidelines. We'll do at least daily cleaning. And then our personal protective equipment, or PPE, ensuring that we maintain an inventory of that, working with site management and partnering with safety representatives to support that we have adequate supplies. And then signage, and that signage can include guidance on masking. It can include guidance on how rooms are going to be utilized, where you'll see a sign up outside the room saying how many people can be in there and what the masking requirements and social distancing requirements are, as well as signage for sanitation stations and that type of thing. And then we've also been preparing our airflow to maximize it in the county buildings per Cal-OSHA guidance, and that has included, there's a particular type of filter called a MERV 13, MERV 13 filters are all in place. And then HEPA filters, open doors and windows, fans are all being considered based on needs. And then county vehicle guidance based on health and safety regulations. We did retrofit some of our vans for transportation with some plexiglass and such, but we'll also be giving guidance on how all vehicles in the county should be utilized, and in terms of how many people can be in the front, how many in the back, having face masks on and windows cracked open, and making sure that you're not recirculating the air, that you're bringing in outside air. All right. So Human Resources has their own work that they're doing under the Return to On-Site Work Plan. They're getting direction and updates from County Human Resources. They're looking at the emergency alternative work schedules and accommodations, which will be reviewed on a case-by-case basis. Partnering with facilities on ergonomic needs. The emergency telework orders are supposed to be lifted July 31st. So working on that, they've worked on the transition to worksite and collaborating on pending telework guidance for any approved position. So we will continue, as I've stated many times, I'm sure this question will come up again, it always does, and we'll continue to work towards a more formal structure where we might have some telework positions, but that's going to take longer than this Return to On-Site Work Plan. And then DBH HR has developed an intranet site focused on wellness and the Employee Assistance Program, and I'll talk about some of that in a minute. They'll be on site at the Hawk, the building I'm in right now, Health and Wellness Center on Dakota. And then we will be tracking COVID-19 cases. People will be filling out a screening app before they come into on-site work, and we will be tracking anyone who tests positive for COVID. I'll talk about vaccines in a minute. So our return to work has a training plan component as well, and so through Relias, our online training, we'll have a training on emotional health check-in. We'll talk about COVID-19 and distancing in the workplace, what to expect when returning. We'll have a wellness outreach series. We'll have a webinar series, and we'll use training committee input. And then finally, there's a supervisor checklist. So each individual supervisor will have a checklist to make sure that we're consistent across the department in how this plan is being carried out. And that will include, having the phased approach and flexibility, following county human resource and social distancing guidelines, a review of your roster and keeping track of where people are and such, the floor plan for the area, identification of any shared spaces and alternative work schedules, any office equipment on loan, and making sure they understand and you understand that DBH Human Resources and Facilities is here to support. And so that checklist will be available online. With all of that said, this is just a general overview. There's a lot more detail in the work plan that we'll be publishing next week, hopefully, that you'll be able to review as well. And in my opening statement in the work plan, I make a statement, and I'll reiterate it here. This is a living, breathing document. Nothing in the document will necessarily be entirely set in stone, because we know as we've went through this pandemic, we have to be flexible and we have to be prepared and keep our finger on the pulse of what's going on. And we will rely on input from all of you, and I'm sure the plan will go through several iterations as we learn through this process what's going to work best for our department and the people we serve. There are some outstanding questions that are why we haven't published the plan yet, and I want to address a couple of them right here. One is, and I'm going to go to my questions page, will our department internally track staff and their COVID vaccinations? This is what we're awaiting guidance on from the county. I will tell you my preference would be that yes, we would track it, that we would understand and have a way of knowing how many staff on site have been vaccinated or not, and that there is a possibility, I'm not saying this is how it will be, but there is a possibility that if you want to go maskless in the department, you have to show us proof of vaccination. Or we may just decide that everyone's going to wear a mask. And so those are things that still have to be determined. Those are decisions that won't necessarily be made by me or the leadership team here. That's where county, the Board of Supervisors and County Council and County HR will be giving us guidance. And they'll base that on the CDC and public health information and Cal OSHA. So it's kind of this transitional time here where we really have to await their guidance to put the final touches on the plan. The other piece of it that we'll want guidance on is, can we also ask about or track vaccinations of the people we serve or the public entering our building? I think it's generally safer if we just require people to wear masks, but again, that's something that we'll sort through as we go through the process. So another question, will we know vaccine percentage of staff? Again, we're kind of going to have to see if we're allowed to ask that question. By all accounts that I've read in my internet research and other sources of information, it does appear that we have the right to ask about vaccination status, and we have the right to have that information known to us in terms of asking, but it remains to be seen how the county will carry that out. The other question, will weekly free testing continue? I believe that the free testing will continue. I don't know how prevalent it will be and how convenient it will be to get it, but I know that there are funds being earmarked to continue testing. Remember, we have 48% of those eligible have had one dose. That's half of our eligible population has not been vaccinated. That half of the population that has not been vaccinated, even if they've had COVID before, are at higher risk than the vaccinated population to get COVID, particularly with these new variants that are more virulent in the sense that more contagious and possibly have more health consequences. And so we should be prepared, particularly as we get through the summer and into the winter, that we will have an outbreak again. Our hope is that by that time we'll have enough people vaccinated that the outbreak will not overwhelm the healthcare system and require or possibly require us to have the different restrictions we've had through the last year. But so long as we have such a high percentage of people unvaccinated, we have to be prepared at all times that a surge could happen that could put us all in a situation where we have more restrictions. And so please do, if you believe in being vaccinated and understand how it's really our only path forward to get out of this mess we're in, keep offering information and resources to those who haven't been vaccinated, and hopefully we can get as many people as possible to make that decision to be vaccinated. It's certainly everyone's right to not be vaccinated. I don't want to imply that you don't have the right not to be vaccinated, but the fact is that the more people we have unvaccinated, the higher the risk is that we're going to enter into a phase where we might have restrictions again. It's just the reality. Okay, let me see if there's other questions. The glare from the plexiglass is very detrimental when I'm backing out. I see the reflection on the front. Can we address that? Okay, so this must be someone who drives, and yes, we'll look into that if there's something we can do about that glare on the plexiglass. There's definitely, accommodations that we have to make with some of these measures we've taken throughout the pandemic, and it may very well be that we'll get guidance and we don't need that plexiglass. We'll just have to see, but that's something that we can look into. I don't have any other questions on the YouTube. Let me see if I have any here. I have no questions on my text either.
Tina sent me one.
Okay, go ahead.
I know this may be premature, but if teleworking is to be considered in the future, what work roles, titles will be considered for the possibility of teleworking?
I love the creativity of our staff to continue asking the same question and hoping that I will have an answer for them. So the question was, I know it's premature, but if we are considering permanent telework positions in the future, what would be the job titles, specifications, etc.? I have no idea. It hasn't changed from last week to this week. I'm just trying to get through the return to on-site work and multiple high school graduations. It is frankly not a priority for myself, the department, or the county to work on permanent telework positions right now. It is a priority, but it's not the highest priority. And so I'm gonna have to ask yet again, please, you need to be patient. Know that we are committed to evaluating this in the future, but it is not going to be worked on now. I have no details today, nor will I have any for the next few weeks, maybe even months, until we can get through the return to on-site work. Once we're in an on-site work situation, things have calmed down, we've got our routine going, we're screening, we're testing, things are looking good, people are getting vaccinated, we're not having outbreaks, then I think I can get my head above water long enough to push that forward. So I do want to emphasize that I am very committed to doing that work. Now is not the time that work is going to get done. I appreciate, again, the questions, and I don't want to deter you from asking questions. I just need you to understand that you're not going to get an answer right now or any time in the near future. So my apologies for that. It's just not, it cannot be the priority right now when we have so many other things that we need to work on. I'm sure you do understand that. All right. Oh, someone said we have to put the fire out before we build a new house. Absolutely. We gotta make sure that we have the good foundation to build on. And so I appreciate your patience. I know it's hard. It's hard for me too. But we will get through this, and we will get to a place where we can consider that. It was being looked at prior to the pandemic, so definitely we've learned a lot through the pandemic. It has taught us that there are different ways of doing things, and we should be looking at that. It may be that it's more effective or efficient or productive to have certain positions that work telework. I'm very open to that. It's just not going to happen right now. So thank you for your questions about that. All right, with that said, I'm going to let you all go. Have a great weekend, and I will be back next week, hopefully with a little more detail and hopefully with a published plan. Thanks, guys.